Hello, and welcome to week 3 of the Communication Unit, Level 3, Health and Social Care. It's Unit 302. Um, in week 3, we're looking at the importance of ICT in communication, and we're focusing particularly in health and social care, not ICT in the wider world, but just how it's used in the care field. Okay, just to sort of think about some general communication ideas. It's very important the choice of channel that you make to achieve understanding. There are different ways of communicating. It can be formal, it can be informal, or it can be quasi-formal. The formal communication channels are usually organizationally defined, and they follow the sort of hierarchies that are from the CEO down through the different management levels to your supervisors, team leaders, and then to you as staff members. Usually it's in emails, it could be formal letters if you're getting something from HR, or it would be new policy statements, or the organisation might have a newsletter that brings out announcements, or it just might be an all staff email, those sorts of things. They're usually letters and emails, pretty much always written if it's formal. Informal channels are more about sort of day to day communication. And because they're informal, they're not necessarily written. It's more about the manager interacting with you as team members or maybe some of the team leaders, and just, having that general conversation over a piece of work. One of the popular philosophies, particularly in health and social care, is management by walking around, which literally means, the manager spends a bit of time out of the office, on the floor, walking around with staff members, just interacting with the service users as well. Um, it really, the idea is not to make it look like the manager's checking up on you and seeing what you're up to. It's more about generally engaging. Really, that's the idea of it. Although, some managers may choose to use it differently. I can't really speak for them. But it's often a good way of doing information as the manager sort of pops in on you. Hi, how you doing? Are you okay there? Hi, hello, Mrs. Jones. What are you guys up to today? Okay, you're just going to be doing something. You're going to have some lunch and that. And it's really just a way of sort of observing and seeing that someone's happy. Is everything okay? You happy? Is your equipment okay? And that sort of stuff, really. It's letting people know that the manager's involved and interested and available, and it's actually giving them time to raise issues. So it's a sort of an informal communication space. Um, it can also be used on official networks, the the water cooler chat, you and maybe some of your team members chatting over a cup of tea at break time, passing information. That's when a lot of information gets shared, really. And it can be, just when people are getting together before they're having a team briefing or before they're doing handover. So it might be that sort of chat over a cup of tea, people coming on shift early in the morning, just getting settled in. A lot of informal stuff happens there. The quasi-formals, so they're sort of planned communications that are partly formal, but can be relatively informal. So they often can be like something like a project team. So if your manager has asked you and a few other members of staff to work on a particular thing, you might be updating a policy, or you might be having a look at creating a new policy, or making a change that maybe service users have asked for, and you might be doing a bit of research for that. So there's going to be a mixture of formal and informal there. You might have to write report notes back to the managers to talk about your progress, or you might have some project charts that you're working on. But you also probably have some sort of general chit chat, and for that, You might use like WhatsApp groups where you're just keeping in touch with each other because you're part of a sort of small project team. That's an idea. So have a think. What other things could be the quasi formal? So you use email, but you can also use it sort of fairly casually. And as I said, WhatsApp groups are pretty common nowadays. Um, so there could be sort of forms that you have to report on, but they could be just a space for where you're just talking, throwing ideas about as well. So you could have them general meetings. Think about how else that quasi-formal channel can be used in a care service, where else you might get together and do a little bit of both, really. So maybe you can jot down some ideas for a moment before we move on. You can just stop and have a little think about where it might get used, or those of you who are already in placement where you may have seen that sort of channel getting used. Have a little think about that. Communication direction. Oh, that's quite important as well, because the flow of communication is quite important, and obviously it flows. We know communication tends to flow downwards from the top level management down to again the staff on the ground. It's particularly used when you're implementing a plan, when your organisation has some new goals, and yeah, the management want to inform people of them, or maybe changing policy, or if teams are getting information, some feedback on their performance. Maybe they've had a CQC inspection. That information will be shared first with the management and then passed down through the teams. And maybe if you're creating a new policy and you want everybody to know about it, so that will be the classic sort of top-down information. It should also be upward communication, really. Feedback from the staff teams going back up to the management. A healthy service has a two-way communication. And that's really important because you need to be letting people know how the progress is going against the goals. And also, if there are any problems where you maybe the team is having trouble achieving their goals, that feedback needs to go back up as well. And of course, if there are any complaints from the service users, that feedback needs to go back upwards as well. And when people are doing supervision, especially at the end of annual appraisal time, when the management may be appraising your but you should have space to feed back and say, where you think things, where you agree, or where you think that was unfair, or where you think that was different. You can also have, especially in a bigger organisation, lateral communication where it sort of goes side to side. So that can be just people who are in a little work group together. It could be all the managers at the same level. So if you're a fairly large care organisation, there could be times when all the care home managers might get together so they can share issues, and relate it to see if things are happening differently in different areas or in, the different services. And it's quite a good way of coordinating how things are working, and for managers to know that they're all sort of working together to the same standard too as well, and that their staff are. So let's think about ICT in healthcare. What sort of ICT do you think is used in healthcare? I'm going to give you a moment to jot down some ideas now before we go on to talk about it a bit more. You might know some, you might have come across some already, or you might really not really be sure. But why don't you just think either what you do know or some ideas where you think it could be useful? Maybe just jot some of those ideas down. Take a minute before we move on to the next slide, because I'm going to be talking about the different way it can be used. But see what you can think of first, okay? So just take a moment, jot some ideas down, and as I said, when you're ready, just move on to the next slide. So we're going to start off by thinking about health information technology. Health information technology uses computers and programs, and it's about storing and protecting and retrieving information, which is often can be clinical, it can be administrative and financial. and it's kept electronically. Now, this could be in your care home, or it could be in a very large general hospital as well. And it's generally considered to have the potential to improve the health of individuals by saving costs and saving time, although some people may disagree with that as well. But you also having improved quality on the documents because they're all laid out in types of software. Everybody who fills it in should use it in the same way. And it also, all of your clinical information, like your lab results, your x-rays, your MRIs, all those sorts of things, should be a fingertip away, really. So here's a little graphic about, this is based in a hospital management system of how HIT, health information technology, is used. And the software is generally all linked up together, really. So here you can see you've got radiology. So you've got maybe some scans from radiology with there, or some ultrasounds. They will be there as pictures that can be called up under the client's name, or under the patient's user number usually. Uh, we've got pathology laboratory, so lab results, really blood tests, urine tests, should all be entered in there with all the detail of it. So again, when somebody comes for a clinic appointment, those things can be called up. And the appointment itself will be scheduled through a software system that's linked right across the service. Your medical records, so your care records, your care plans, they'll all be linked onto the same system, so they can be opened as well. Consultant management is like booking in consultants for clinics and things, and their own documentation too, and who they allow it to have access to their registrars, to their health officers. Outpatients department, the patient help desk, so that they can see who's doing what when, and who's involved with whose care, and billing and invoicing for those of you who are in a service where there is insurance requirements, and invoicing, that would all be linked to the same sort of system. So it could generate, the HIT could generate all these different things. It could store, it could retrieve and generate. In the UK, we tend to call it electronic healthcare records, EHR. It's pretty much the same, I think, in other countries as well. Primary use, patient care delivery, management, I mean, all the same sorts of things, really. And this is when you're putting your care plans or your assessments, and your reviews are all in there too. And leading off from that, you could have links to other types of software, such as financing. And there could be also there are aspects that a patient can actually open up and look. I've got on my phone, I have an NHS app, and through that app, I can see my medical records. So I can see the records of the last appointment I had with my GP. I can see information from any, say, like blood tests that have been sent off. That would all be filed there, so I could open those up when they've come back. I can make an appointment. I can arrange a vaccine. Like during COVID time, I just had to click on to my NHS app and to booking my vaccination appointment, and that would be the same for any other types of vaccines, like flu jabs and things like that. I can book an appointment with the doctor or with the practice nurse if I just need to go back to a clinic. And I can reorder my medication. So if you've got ongoing medication, long-term medication, you can just go on there and just click on it, and you'll get it. And it will flash up for the GP, so he knows you've reordered it, and he will sign it off electronically, and then it will get sent to the pharmacy, a local pharmacy. You nominate a pharmacy, and the local pharmacy will get the information and prepare your meds, and then send you a little, usually an email or a text message to say your medicine's ready, come and get it whenever you want. So those some of the things that you can do. There's probably other things in the NHS app if I could remember it, but those are the things that I tend to use it for quite a lot. You can also do it for booking a telephone call if you just want a chat with a doctor, but don't feel the need to come in and book up one of their appointment slots because they're pretty busy. And also, yeah, you can ask questions as well. You can ask for your medication to be changed, and they might do a review. Sometimes I might call you in, sometimes I might not. But so there is a space for you to sort of ask questions to the doctor as well. Now, some of them are quicker to respond on that than others, but it's all there and it's all in this one little app on my phone. I think you can also have it as an app on your tablets or on your laptops as well. So there are any digital document that contains information on individuals' health and care are electronic health records. As I said before, they can be online or internal network or on a device. So if I was working in a hospital, they would be on part of the hospital network. So I would probably have a login number and go in if I was a member of staff, and then I could call up Mr. So-and-so's records if I was working with them. And there would be limitations on who could open up records, due to data protection. So I'd have to be involved in their care, really. I couldn't just look up, just because I worked in a hospital, I just couldn't look up, say, my husband's records and see them unless there was I'd had data protection permissions. Why are electronic health records important? Because they believe that when it's digitalized, it's more secure. No chance of things getting lost, damaged, and destroyed. And they believe it saves time, because one misfiled record can cause a lot of problems. So, which mean that research might have to be done again. You might have to, if you lose the MRI, you may have to even go and pay for another MRI to be done, and that's so it's a real problem. The electronic system, the idea is it's all linked as it's done. So when you go in for your MRI, that they're using a laptop or they're clicking it through. Once the picture's been taken, it's being attached to your case. There is still room for mistakes, but not quite as much as with the paper records. What are the benefits of electronic healthcare records? Well, they take care of record management. You don't need tons and tons of cupboards, so there's a space issue as well. They're much more secure because they need passwords to open. So they comply with all the data protection regulations without you having to remember what to do. The patient is at the center of it because everything goes in under the patient's number. So everything that anyone's had to do with him, they might go to a skin clinic for, a blemish on their face or something. Or they might have gone to the fracture clinic because they fell over when they were skiing and broke their leg. Or they might have had COVID. All these things will be there together. So it doesn't matter what different sorts of services they're involved with, as long as you've got the patient's number or name, address, date of birth, you should be able to find all those records together. And of course, having up-to-date records to hand when you are in a clinic appointment, it improves care. You don't make mistakes. You don't give them a medication they're allergic to because it already says in your records. You don't do a test that's already just been done. You're not wasting time. Ideally, records are shared between professionals, and that can be approved at local level. So, as I said, it might just be a password thing, or it might be everybody on a certain care team has access to these group of records, and then that level, and then that level. It saves the patient from having to keep saying things over and over again. It saves them from having to bring their medication in to show people this is what I take. It saves an awful lot of time, and improves communication between the different clinicians, as I've said. They're also highly customizable. Sometimes this is done within different hospitals or even with different services. So maybe the fracture clinics might have some special extra pieces in that they need that not everybody else has, to do with bone breaking and that. And maybe the blood clinics would have some added areas. So usually the programmers can actually program certain changes into them. Or there might be different packages that are added to for different clinics. Um, so one of the ones that is used an awful lot in the UK NHS is one called System One. There are others, but they are trying to encourage hospitals to sort of move towards all using the same systems, because eventually they will be able to talk to each other when someone moves across the country and they take it. So they are encouraging people. System One is one of the most popular ones that's being used. If you Google System One, you'll come across the organisation that creates it, and they've got a website full of information about it, so you can have a look at it there. Okay, so that's electronic records. Another type of ICT really is something called telecare, and this is a much more recent development. I would probably say over the last 20 years. And it was actually developed from an alarm system, which have been used for many years, really. And it used to be built into sheltered housing schemes with a pull cord. Some of you may have them built into your care homes with a little red pull cord that you have in the room. So if someone has a fall or feels a bit unwell, they're able to pull the cord. An alarm will sort of ring up in the office, and you know that someone in room 13 needs some help. Well, they took the idea of this and really developed it, and created some systems that weren't quite so tied into the building, if you will. And you could suddenly get neck alarms and little alarms that you could put in your pocket, which you can actually press. So they were more movable. So instead of just being attached to your room with a cord, you can actually move around the building. And if you had to fall, you could press your pendant alarm. Maybe you had to fall out in the garden or something, and then someone would be able to speak to you. Now, the idea with telecare is there's got to be somebody on the other end of the alarm, as you can imagine. And yes, if you're in a care home, of course, it's the care home office. But if you're outside in your own home or in a housing scheme, then they will have to be, you either have as a link your next of kin if they live locally and can come and give you a hand, or they tend to pay towards an organisation, a care organisation that monitors the alarms, and they will make a decision on what to do. They'll speak to you, they may send an ambulance, they may come out themselves if someone's just got in a bit of a pickle, or they may send the emergency services if someone sounds like they're in a bad way. They might come out themselves and also send an ambulance. So there is a 24/7 monitoring. And as I said, it only really works as long as there's somebody on the other end, as you can imagine. But also, they've developed lots more things since then. And here's a little graphic to show you some of the things that they've developed. They've developed high-low temperatures detection. We had an issue because in certain parts of the country it can be very cold in the winter. Elderly people who worried about paying the bills often stopped putting their heating on in the winter and actually made themselves very unwell. Or some of them, because of their dementia, would maybe forget to turn the heating on as well. So you can have a high-low temperature detection. If the temperature's gone too high, that it's going to be detrimental to your health. If it's going to be too low, it will alarm at the service that's monitoring it, and they will know that something's not right, and they will probably come and do a visit, or maybe send a community nurse out to see, depending on what the organisation is. And other things that we have a lot of is door exit alert. So if maybe someone's managing quite well in their home, but they have got some dementia and they do sometimes wander in the night, the door exit alert will go, and that means that they've left the front door and they've gone out. And if it's sort of like the early hours of the morning and someone's left the front door and they know the person lives alone, then they will come round and find it, and they might alert the police as well. They might need someone to be looked for. Flood detectors are really helpful. You put them bobbing in the bath, um, so to stop people turning the bath on and wandering off and sort of forgetting to turn it off. I think some of we could all do with that sometimes. These little things float in the bath, but they know how far they can assess how far from the top of the bath they are, and there's a certain point, and if the water gets past that point, um, these alarms will go off, causing the person to hear it. Now, hopefully, it'll settle in with them, but they usually come and turn the bath off. But it's quite useful. Bed sensors, very helpful. Epilepsy monitors. If someone has a fit, the monitor will lie in the bed, sort of under the sheets. If someone has a fit, it will register that. It recognizes the types of movements with a fit, and it will alarm somewhere. And families often have this at home if they have young people with complex needs, learning disabilities that they can't call out, or things like cerebral palsy, where they may have fitting or just epilepsy in general, so they can come and deal with the children in the night. And they have another end to it, which is a bit like a baby monitor, really. So if your epilepsy monitor goes off, they know, come in, and the child's had a fit. So very, very useful. Lots of personal sensors like that. You can have a bed sensor that if someone wets the bed, it will alarm as well, and again that will go back on the personal monitor, so people can do that. So all these, they don't just help elderly people, but they can actually help young people with long-term chronic conditions as well, try and carry on living at home. So telecare, useful development, as I said, it was developed by the first company who did the red pull cord, so it sort of moved on from there, really. And that leads us into telehealth. So there is a difference between telecare and telehealth. You just need to be clear of that. Telecare is all those alarm systems that are there to support you caring for someone. Telehealth is about people with long-term conditions managing themselves. So it's a little bit more about independence, really. It's particularly good for people with chronic conditions, COPD, heart failure, diabetes, and other physical conditions. Maybe they're wheelchair bound, and lots of things that need to be checked. It helps them to self-manage their conditions. It helps them to stay out of hospital, maybe not have to go to so many outpatients clinics as well, and not have to go to so many doctor's appointments. And this is usually a smart hub. It can often be linked again to people's phones or to their laptops or tablets. And they can have USB plugins, which can be blood pressure readers, pulse oximeters, blood glucose monitorings for diabetes, and they all transmit the readings. Sometimes they have to be plugged in using a USB. Sometimes they Bluetooth across, depends on the system that you're using. And there can be some sort of coaching and mentoring that you normally go through. So the community nurse would sit down with you and work out the package that suits you. And then they would ask you to send up your blood pressure readings, 3 times a week or every day or those sorts of things. And then the process, the software identifies when things are in normal limits or when things are not. um, the community nurse is able to adjust some of that. So if like what's a normal limit for one person might not be so normal for somebody else, they're able to manually adjust that and set it so that they will get the alerts for the right person at the right time. Um, and then it's up to them. Then it will register on their laptops in their offices, or usually on a relinked tablet, which they carry about with them all the time. and they can decide, oh, Mrs. So and so's blood pressure is very, very low for a while. I either need to speak to the doctor and tell her to review her medication, or maybe I need to go and do a visit and see what's going on. And that's up to the community nurse to make the decisions. But it helps people just carry on with their normal lives without having to constantly phone up the GP every now and then. If they feel a bit wobbly, they are actually able to check their blood pressure. They've got the machinery to do it. And it's really wonderful because it's given a lot of people their sort of free time back, that they're not constantly backwards and forwards, which can be quite soul destroying, especially if they remain fairly well. And also, it's very practical for the practice nurses and the GPs because it enables their time to be used better. So instead of having to go and see Mrs. Jones because you haven't seen her for a while, you will go and see her if her BP's gone wrong or if her breathing's gone down. Then you know that you should go and see her. But it also means that you can say to her, "Oh, okay, well, I'll see you again in a few weeks unless something goes wrong, and then I'll come earlier," that sort of thing. So instead of just having to book a visit because you haven't seen her for a while, you have a better communication by knowing that her blood pressure is fine, her breathing is fine, that sort of thing. So telehealth to help people remain at home and remain more independent. Telecare is to really support people managing. So here's some questions for you. What other types of ICT do you think you could use at work in a care home? Maybe jot down some ideas. What would you use it for? Give some thought to it, because you're going to be writing about it in your assignment. Have a little think about social media as well. How could you use social media in your home, like Facebook, WhatsApp, those sorts of things? Could you? Should you? Is it right? Maybe have that debate. Maybe have that debate with some of your other students, or maybe some of the people at work. Say, what do you think? How could we use social media in this care home? Is it good? Is it right? Are there things we need to think about? What are the impacts of all these systems? Start thinking about the impacts. We've talked about a few different types of systems. Are there positive impacts? Are there negative impacts? Try and sort of make some decisions about that. I've added some extra bits of information in your extra reading for you to think about. So have a look at that and then have a little read and see if you had some more thoughts about what are the positive, what are the negative impacts. They might pick it up from your wider reading. Just a little comment on social media. There are some pros and cons. You can do it for recruiting, for researching recruitment or carrying out recruitment. You can do it for answering common questions. So if you get a lot of similar questions about your care home, you could address something on social media. You could use social media to increase the awareness of your care home, to let people know that you're there. Maybe some people don't know about it. Maybe your care home's only been open for a short while and you're fairly new. So you can bring it to people's attention. And it's also very cheap and cost effective marketing, isn't it? Social media. Other issues about social media: reliability. You've got to make sure all the information that's on there is accurate. It can be a security risk because you can hack into it and then other problems can come. It depends, make sure how is your social media linked to other things. Make sure about the legal issues, particularly around confidentiality. If you're going to photograph your service users, doing a nice activity, you've got to have all their consents, you've got to have it written, you've got to have it filed away somewhere in case a family member makes a complaint about it, just as an example. So you have to think about their privacy and confidentiality. Are they able to give permission? Have they got dementia? Are they aware of what you're doing? Will you be criticised for using that sort of picture? A lot to think about, really. But there is possible uses. So have a think about that. That's social media. But you can also think about some of the other things like electronic care records. What are the pros and cons of those? Telehealth, what are the pros and cons of that? telecare, what's the pros and cons of that as well. Okay, the last few slides we're going to talk about data protection. We have a question in task 3. Explain the issues around data protection, how it's implemented in health and social care. So I'm just going to give you a bit of an overview of data protection, but you need to do a bit more reading on your own about this. I've given you a document on data protection for you to read. That are some issues for organisations that you just want to pick up and sort of give some thought to. That will help you answer that question. Okay, why is data protection important in health and social care? It's really essential because it needs to help people feel confident that their information is going to be used appropriately. It should allow them to control how others use their personal data. And it enables people who hold their sensitive data to understand what they can do with it and how they can store it. So it's a policy document that should give you, the staff as well, some clear guidelines in what to do that's correct. So every care home should have its own data protection policy that follows the legislation, of course. Okay. If people don't feel confident that their data is being looked after securely, they may be, not less wanting to tell you things, especially if stuff's very private, very personal, and they might not want to share information. It makes it quite difficult for you to gain the trust if they know that their stuff's not really being looked after properly. And if there's an incident, it takes quite a long time to get people's trust back as well. So bear that in mind. If you don't protect the sensitive data, you can be fined, and there are penalties, and some of them go from civil to criminal, really, if it's deemed there was willful negligence. If you decided to sell off a lot of personal information to an advertising company about the people where you work, their likes and dislikes and those sorts of things, you would be some serious hot water there, because you would be doing it for your own financial gain, giving information over without their permission. You probably would lose your job, and as I said, you could go to prison. You certainly would be fined. So bear that in mind. Okay, some of the common data protection issues in healthcare. Some of the things that have happened or are a problem: not being aware of how to store data properly. And this usually comes from the organisation not having a proper policy. So if your organisation hasn't got a policy, you might want to raise it and say, we should have one, because otherwise we don't know what to do. It may be included in a confidentiality policy or something about the care records. So, do check it out first, but there should be something. Another common data protection issue is making the mistake in how you store it. Not storing it safely, not locking it up if you're using hard copies, not pass protecting it if you're using electronic copies. Another issue is losing documents, which is one of the issues about the hard copies, because bits fall out, or you could lose it on your computer if you don't have a proper way of, say, storing it that everyone does it the same way. Inappropriate disclosure, things could get lost and left. I mean, there's one of the things is carrying USB sticks with people's data on them. An absolute no, but somebody probably does it somewhere. Misdirected emails. We've all been in the situation where we sent an email to the wrong address. So one of the things is you have to be super careful about is if you're sending an email about a service user to someone, like to a clinic or to a GP or to the hospital, that you don't send it, I don't know, to your Weight Watchers group by mistake or something like that. So you have to be super careful, really. Unauthorized storage and access to patients' records, leaving it around for the cleaners to come and have a look at, or the contractor who's coming to clean the windows, That would be a problem. Not locking it up properly, storing it. I don't know, in the dining room, in a box in the dining room where anyone who's going through. So which would mean that other service users could read each other's files, those sorts of things, or any family members wandering through could pick it up. You know, being left outside in magazine racks, all sorts of things. Some of these things I have seen, so you don't laugh at them because I have seen some of these things over the years. But nowadays, most people are pretty good about it. But, it still happens. So, what are your duties under data protection? And this is important, and you do need to be pretty familiar with this. You need to be able to recite it if someone asked you, really. The original Data Protection Act in the UK was 1998, and then it got reviewed in 2018. And when it was reviewed in 2018, you often see them use the initials GDPR, okay, which just means General Data Protection Records. But when they say GDPR, it comes from it was actually, review was actually done in 2016, but by the time they got it through and turned it into legislation, because it takes, got through Parliament, it was 2018, the update. So, what do you have to do? You have to keep your documentation up to date with what you do with the patient's information. So if a patient changes their mind about who's allowed to see their stuff, maybe they say that their daughter or son can see it, and maybe they decide that one of them can't after that, or the other way around. You need to make sure that you're up to date with that. That's your responsibility as the care manager. Ensuring that any paper files, hard copies containing personal data are kept locked or secure at all times. They usually need to be expected to be in a locked cupboard within a locked room very often. And although the locked room, people will come and go in that cupboard needs to stay locked all the time. Usually it's filing cabinet at the very least. Sometimes it's a cabinet within a cupboard within an office. So, ensuring electronic records, e.g., patients' medical history, is also protected. And that's usually because you log on with passwords. The system should be set up for you to be able to protect it so that, it would only be the care staff who could actually go in and change these records, care staff and their immediate supervisors. So if one of your cleaners logged on, I know I keep saying the cleaners, but they're often the people cleaners or cooks in the kitchen logged onto the system, which they probably can do to get their emails and things like that. They wouldn't be able to open the records because the system hasn't given them the permissions, and that systems have different levels of permissions. So that would all be set up usually from your IT department. Ensuring personal data is disposed of using the correct procedures when no longer needed. So if someone takes a note down about something and then records it somewhere else, they need to dispose of that in a way that other people, you don't leave people's phone numbers lying about on the desk. If they have to be shredded and thrown away. Ensuring that data is only used for its intended purposes. So, like I said, you've got information on people's likes and dislikes for their care plan. You do not share that with the local soft drink company who's trying to sell something. And you do not share their likes and dislikes with anybody else who comes asking for it, really. And people will do, and they create all sorts of ridiculous reasons why it's very useful for you, and it's easy to get caught up in this as well. And of course some of these things could be scams as well. So we know now that electronic scams are probably the one of the largest offences that are actually happening now. So ways to steal from people electronically is becoming much more popular than just breaking into people's houses because it's just easier. So remember, you need to help protect your service users from scams as well, and that's hard work. But keeping their information safe is a good start. So if somebody rings you up asking for people's date of birth over the phone, you do not give it. First of all, you need to know who they are, but I would say don't do it anyway. And if they want it, they need to do a proper request for it, but through a proper channel for your management, really. Ensuring that any staff who deal directly with patients are trained. So you should have some in-house training about data protection. Making sure you keep up to date with the latest data legislation. Now, sometimes in a larger organisation, some of the managers might be sort of data protection officers, and that would be their responsibility to keep all the services up to date, because the legislation can change, and someone's got to have a job of keeping it up to date. So you might have a designated person. It might be a manager. It could be your human resource department. It really depends. Different organisations do it, but they need to do that, and they need to send out updated policies. Ensuring that any suspected data breach is reported immediately to the Information Commissioner's office, and then it will be investigated, and the outcomes will be as they are. Somebody might be fined. It might be accepted as an accident. It might not be. It might be saying that someone's doing it for financial benefit. Doesn't really matter. Your job is to make sure that information gets sent on. As a junior member of staff, it's probably better that you report it through your manager. And as I said, very often the managers are the information data protection officers for their service anyway. So they would be the one who would contact the Information Commissioner's office. But in this country, it's got to be reported by law. Sometimes they don't need to do anything about it, but the reporting has to happen. They make a decision about what to do about it. What do you do if there are signs of a data breach? As I said, if the suspected or apparent personal data breach involves more than one member of staff, then notify the data protection officer immediately and record it. And if you think you've seen a breach, write it down first and then contact them. If it's one member of staff, then there will need to be some sort of investigations. But most importantly for you is you have to report it either way. Now, in the policy, there may be an online form for you to report things. And there will be a guide telling you exactly what to do and who to report it to. It could be as simple as sending an email to your manager. It could be completing a form. You need to do it within 24 hours, though. If you've seen it, you need to act on it within 24 hours. Because otherwise people will come back to you and say, well, why didn't you do anything about it? You let it perpetuate. Okay, so what next? You've got some wider reading and extra reading about ICT in organisations, and particularly about ICT in developing countries. Hopefully that might be an interesting read. There is a summary of data protection issues for your organisations aimed at healthcare organisations. So you need to be aware of that and read it. And I suggest also that you might want to just Google the 2018 data protection and just be up with it. And read over what you need to do yourself. Then take the data protection quiz to consolidate this week. And that'll be it for this week's work. Okay. Thank you. And that's all. And I'll see you for week 4. Last week of 302. Thank you.